My name is Chuck, and I beat cancer.
I had to go to the emergency room, and the doctors really helped me.
From the receptionist to the doctor, people at Sutter Health, they just took care of me.
If it weren't for Sutter, I wouldn't be standing here talking to you.
We're trying to save lives here, or bring lives into the world, or do all these wonderful things.
Healthcare is about people. It's people taking care of people.
At Sutter Health, we have thousands of very dedicated and talented individuals. We share best practices throughout our organizations to assure that our patients get the best services possible.
Sutter Health is a phenomenal organization, but more so, the staff that we employ, they're equally as phenomenal, and they really lend to our ability to provide this phenomenal patient care that we do. What's great is that this is the Sutter Difference.
Everything's looking good?
Our not-for-profit Sutter Health Network is comprised of many special people. Through our Sutter Medical Network, we have relationships with more than 3,000 physicians that serve more than 100 communities in Northern California. Our family also has 24 hospitals, as well as research centers, occupational health clinics, and long-term care centers. Through our extensive home health and hospice services, we also care for patients in the comfort of their own homes.
It's a whole community of care. This is not a trade secret. It has to do with building a good staff and ultimately being accountable, not just to the patient, but to one another.
To provide a more seamless and coordinated experience for our patients, our physician organizations and hospitals are organized into 5 regions. This regional approach allows us to work closely together to further improve healthcare quality and bring even greater value to our communities. With an eye on the future, Sutter Health also has a strong strategic plan.
Part of Sutter Health's vision is to lead the transformation of healthcare in California. Sutter Health completed a strategic plan, and it outlines the vision for our organization. And what we did is we actually put together a story map for our employees, for our physicians, to try to give them a visual of where Sutter Health is heading. We're going to create an environment that is going to be extremely responsive to what the patient's needs are.
Hi, Mrs. Frank. How are you?
Within our Sutter Health family, employees are the bridge in transforming our organization so patients receive the best care possible. We're providing care where and when our patients need it. This means we're improving existing facilities and building new patient care centers. But our efforts to best serve our communities go beyond bricks and mortar. We're a leader in adopting technologies that make our medical foundations and hospitals the best places to give and receive care. We're providing tools like medication barcoding technology, our EICU, and an electronic health record system.
Stretch, 2.
We're also investing hundreds of millions of dollars to improve the lives of those in our communities and those who cannot afford to pay for health care.
We spend a lot of time in Sutter Health looking at what will satisfy patients and what will make the employees of Sutter Health good caregivers, whether they're at the bedside or elsewhere in the organization, because we sustain each other.
These are our mothers, sisters, brothers. These are people within our community. There's nothing more gratifying than knowing that you, as an individual, within a department, within an organization, within a system, have impacted one of many communities. I mean, that's the stuff that makes you go to sleep at night. That, to me, ultimately drives why we're all here.